I'm Wendell Wright, certified hand therapist at the Orthopedic Institute of Western Kentucky. Today I'm going to show you how to make a really simple finger cylinder splint. The advantages of this splint is it has superior rigidity and lower profile, a lot better than a popsicle stick and piece of tape, and also a lot better than the aluminum foam splints that you might find in pharmacies and maybe even in ER. Really simple, quick, easy splint to make, and I'll show you how to do it. The material we're going to use today is Orfit Light. It is a material that sticks to itself pretty well. We're going to heat it up using dry heat because it sticks better that way. And I'll go to get the heat gun and we'll get her warmed up. So our material is warm now. You're going to turn the patient's hand to where you can work from their volar surface and use gravity to your advantage. You want to just kind of lightly pinch it on the dorsum of the finger and then carefully cut with your scissors along the back of their finger. And you have a cylinder splint. All we have to do now is let it cool and firm up, and then smooth the ends, the edges, and it'll be perfect. This is a L3933 billing code, and a very effective splint. It's also a lot better than the little gutter splints that a lot of people like to make because the Velcro strapping on the gutter splints, it's uncomfortable and bulky. Really nice little finger cylinder splint. I'll show you what it's like finished up in just a moment. Okay, so I've cleaned up the edges. I've dipped the tips of the splint in warm water so I could smooth around there so there's no rough edges on the splint. So we can apply the splint back on. The seam is the top of the finger. We want to make sure that the splint length is appropriate so that she is still able to flex at the IP. Now, why would we make this splint? Perhaps for something like a PIP region fracture. Might do it for a boutonniere deformity. And of course, for that, it would be necessary to extend the PIP joint as far as you can and leave the IP free so that they can stretch the oblique retinacular ligament. That's our finger cylinder splint. It takes 5 to 10 minutes when you get good at it. Good splint.